Hello guys, it has been a couple of weeks. In my last video, I was talking about my test results for titanium sensitivity to help me decide whether or not I wanted to get the plates removed. And I was just waiting to get a little bit more information and talk to my doctor before making a final decision. So I do have an update on that for you today, as well as a quick update on the physical therapy and some progress I've made there. Orthodontics, and then at the end I'm going to tell you kind of what the overall plan is and something big that is coming up in the next couple of months that I'm excited, also a little bit nervous about. Another sort of oral surgery procedure that will be happening, so I'll get to that at the end, but let's talk a little bit about the final decision on the plates, or at least the decision for now, I guess, and we'll get into a couple of other updates. So after I got the results back from my titanium allergy testing, found out that the only thing I had a somewhat positive reaction to was nickel, which can be in some of these titanium implants. Even if they say they are pure titanium, they can still have a little bit of nickel, and they can be giving that off basically into your body once they are put in. So I did want to ask the lab that did this testing how concerned I should be considering the level of positivity I had from the test result, as well as the actual implants that I have, and whether this is something that, just from their perspective, like, should I be concerned about this? Do they think that that would cause any kind of reaction or problem for me in the long term? And whether, just kind of on their own opinion, should I look at getting these plates removed because of that or not? So it was kind of reassuring to hear from them that based off of my test results, they really didn't think that the amount of nickel that might be in my plates or screws and the amount of sensitivity that I showed from the testing would really pose that much of a problem. And that if there was anything that I might be experiencing because of that, likely I could sort of work around that just by supporting my body in other ways, like with supplementation or just certain like dietary and lifestyle strategies that could help reduce any kind of reaction from that. So their advice really was, given the risk of removing the plates and kind of the side effects or consequences that could happen because of that, they said they thought I should just leave the plates in. So that was actually kind of nice to hear, to kind of get an outside perspective, a neutral opinion maybe on all of this, and from people working at the lab that was, where they do this kind of testing all of the time. I did also have a conversation about this with my naturopath, just going over the test results, any other concerns that I might have about the plates and screws, things like EMF exposure, electromagnetic fields, and kind of having like metal basically in my body, if that could pose any potential long-term problems or risks. And just given that some of the places where I'm still feeling like pressure or inflammation, whether that is just part of this healing process or if it's something that I should continue to keep an eye on in terms of having the plates removed, and wondering if any of that could be related. And after discussing with her, our plan at this point really is to just kind of leave the plates for now. And if over the next couple of months, and given a little more time for healing, if I'm still really noticing things like pressure in the places where those plates are, or just feel like anything still feels off or has gotten worse, we might revisit that conversation. But very likely at this point, just going to leave the plates, maybe think about some sort of long-term additional support for any kind of small sensitivities or kind of immune system reaction to that. But otherwise, just given that the risk of having the plates removed and any like nerve damage or further tooth damage just doesn't really seem worth the potential of any of that happening to have them removed at this point. That said, there are a couple of things that I'm still sort of paying attention to or keeping an eye on, just little symptoms or things that I have continued to feel throughout this healing process that I'm pretty sure are just part of the normal healing. I think what's hard is that nobody can really say what is normal healing for any one individual. Everybody's surgery is going to be unique and their healing process is going to be, just depending on your own body and your particular procedure that you had. So I think it's hard for me to know whether things that I am experiencing now are completely normal and are just going to fade away over time, or if they're things that I should potentially be concerned about and maybe thinking about why these things might still be happening. And the things that I have been experiencing are just again, continued pressure, especially up here, through my sinuses and my nose where those plates are. I have sort of some drainage, or just I feel sort of almost pressure in my upper palate when I'm talking, or sometimes just if my nose gets a little bit stuffy, I just feel pressure throughout that whole upper palate and sinuses. And it kind of feels like it's been changing over the last couple of weeks. I feel it, or I notice it a little differently than I had before, which maybe that's a good sign that it's continuing to heal and improve. It may also be that I'm getting more feeling back or nerves regenerating, because that seems to be kind of the last place that I still have some numbness, is in the roof of my mouth. Again, I'm not totally sure how to interpret all of it, but it's just something that I am sort of continuing to pay attention to, or just kind of document what is happening so that I can know if it is getting worse or feeling like a problem versus feeling like it's just continuing to heal and it's going to get better. Another thing that I have experienced is just some general achiness or soreness in my jaw, in my lower jaw, also even just kind of all along the upper jaw area. It's sort of a dull ache. It's a discomfort. I wouldn't say it's painful. It's not sharp pain. I also kind of wonder if it's just from maybe the orthodontics and my teeth continuing to shift and just getting more feeling back in my teeth and my jaw and everything. I am sort of just assuming at this point that it is part of the healing process, or maybe just another phase where, as things continue to heal and as I continue to work on my opening my range of motion, some physical therapy exercises, that I might just be having some general inflammation or soreness that is normal. But again, I just want to kind of keep an eye on it and make sure that it's getting better over time and not worse, or that maybe once I'm done with the orthodontics and get the braces off, that starts to go away. If any of you guys that have had this surgery, if you're at a similar point in your time frame as I am, I'm about 8 months out from my surgery at this point, or if you're further along and you want to share any of your experience, if you had any of this throughout the maybe later stages of recovery where you felt just some soreness or achiness in your jaw, I would be really curious to know if anybody else has experienced this. So definitely leave a comment and let me know if that is something that happened to you, if you had jaw surgery in the past. I also had another appointment or follow-up appointment with my physical therapist. I saw her a couple of months ago, and when she picked up on some asymmetries, kind of the right side of my face and my jaw were not as mobile, and I had some more tension on that side, and just generally was a little bit lopsided in terms of the recovery, or kind of also with the numbness and getting feeling back in different places. So she had given me exercises to work on that I have been doing for the past couple of months. And so I checked back in with her, and she was really happy with where I'm at now. I think everything looked a lot more even. I was not tilting my head to the right like I had been before. My posture was better. I could do all of the exercises that she was having me work on without compensation patterns. And so she was really pleased with everything, and basically said at this point to just kind of keep working on some of these things and maybe check back in with her once I get to about the 1 year mark, and just maybe kind of see how things are. The one question I had for her was more about my range of motion in terms of opening, which I still feel like is a bit of a struggle for me. It's something I continue to work on, and I do feel like it has gotten better, but very minimally. And again, I think that this could be something that over a longer time frame is just going to improve on its own, especially if I continue to stretch it and work on it. She did give me a couple of things that I can try, to some sort of resisted stretching kinds of things, very basic. But she also said that it might just be that this might be kind of my new normal, where like I have enough opening to function, and it might either just take a really long time for that to get better and better, or that given how much they moved my jaw, it might just be that my new normal is going to have less range of motion than I did before. A couple of people that I have talked to that have had this jaw surgery many years ago did say that it really just took a long time for that to totally heal and to feel like they had better range of motion, and that even doing all the exercises in the world wouldn't help as much as just giving it time. So I will be interested to see maybe when I get to the end of the year, once I get to 1 year from my surgery or even beyond that, how that continues to improve. But I do plan on also just continuing to do some of these exercises or work on the stretching to see if I can get a little better range of motion. I will be going back to my orthodontist in about 2 weeks, and hopefully that will be the last adjustment I will have to have, or they will at that time be able to give me a date to have the braces taken off. I'm really hoping that that will kind of be the last one. Again, it's just this one tooth I have that is getting put into place. It just needs to move a little bit more and then I will be done. So I think it's partly just a matter of seeing how much it has moved since the last time and getting 1, maybe 2 more adjustments in. But I'm really hoping that the next appointment I have, they will be able to tell me, okay, you can get your braces off when we see you next time in however many weeks. I will, of course, keep you guys updated on that, and that will certainly be something I am looking forward to. So the last piece that has come up over the past couple of weeks is something that I talked a little bit about in a previous video and has kind of been in the works for a while now. I mentioned in one of my earlier videos about jaw cavitations. This is something that I came across when I was researching my jaw surgery and really learning more about how oral health plays into your overall health. And given that I have dealt with chronic fatigue symptoms and hormonal issues for many, many years, I'm always exploring like where this could be coming from or what might help me feel better in the long run. So when I heard about these jaw cavitations, it was something I started to look into a little bit more. And now that my surgery is over and I've had enough time to heal, is something that I started to explore further, and was talking with a dentist actually in Germany who specializes in doing these procedures where they clean out these cavitations, which are basically just inflammatory spaces in your jawbone. If you've had wisdom teeth removed or root canal teeth, these spaces can apparently, like if they don't heal super well, then they can become areas where there's sort of chronic inflammation, and it can then kind of cause systemic effects. And one of the things that really intrigued me about all this was that many of the patients they have seen with these cavitations or this chronic inflammation also have very similar symptoms to what I have been experiencing, things like fatigue and brain fog. So I was really curious to kind of dig into this a little bit more, find out if this might be an issue for me and if it's something that I could get fixed basically, and see if it will help me at all. So a while back I had sent in some x-rays to them. They had given me a preliminary diagnosis saying that it did look like I had 4 cavitations in all 4 wisdom tooth areas. I also have this dead tooth from my jaw surgery that they would basically remove and give me an implant for, because in their view, having any kind of a dead tooth in your body can also pose systemic problems in the long run, rather than doing a root canal and then kind of waiting to see if you have problems with that down the road. I did talk to a couple of people here in Minnesota about this same procedure. There are people here that do it, but very similar to my jaw surgery and finding a surgeon for that and opting to go to Spain for that surgery, there's not necessarily like a really strong protocol around it that they're following. And what really impressed me from this dentist in Germany was how they really treat you holistically and are looking to really help your entire immune system and your whole body function well. and to make sure that you are really ready to heal from this procedure when you go do that, so that you can have optimal results. So they have a lot of protocols before and after your procedure that they follow to help you be in the best place to have the procedure done and then be in the best position to heal properly afterwards. So ultimately, I have made an appointment with this dentist in Germany. I will be going to Germany in October, the second week of October, to have these procedures done. I really want to just keep pursuing whatever I can to help my body heal overall and kind of like optimize my health again, so that I can hopefully have less of this fatigue and maybe get my hormonal function back into a better place. I'm really looking forward to this trip to Germany. I probably have never looked forward to having a dental procedure or dental surgery as much as I am with this, but this should be relatively minor, especially compared to the jaw surgery. In terms of the recovery, it should not be that big of a deal. So that will be what is coming up in these next couple of months, getting the braces off, getting ready to go have these cavitations and my tooth removed in Germany, and kind of just seeing then from there, how does everything feel at that point, given that I will have had the braces off for a little while. Maybe having these cavitations and this dead tooth removed might help with some of that residual just like achiness or pain that I have been feeling. And at that point, I can kind of reevaluate and really see where I feel like I'm at in the healing process, and if there's anything else that is like coming up or still lingering that I feel like needs to be addressed or is potentially a concern. So that's kind of my big update for today. Kind of dumped a lot of that on you guys, but again, I'm really looking forward to having something on the schedule in a couple of months that could potentially be another step in this whole healing process for me. I will keep you guys posted once I see my orthodontist again about getting the braces off and about prepping for this trip to Germany, and anything else that is coming up, how the plates are feeling, or how this sort of general pain or pressure is feeling. Healing process keeps going. As always, thank you guys so much for watching and for continuing to follow along. You can give this video a thumbs up if you like it. You can subscribe down below if you want to continue to get notified when new videos come out, and I'll talk to you guys soon.